Okay, this is the MDC4 Exam 1 Concept Guide. Alzheimer's is non-reversible. It's progressive. Environmental. TBI is most common in women. The 5 A's are apraxia, which is inability to use words or objects. Amnesia, which is loss of memory. Anomia, which is inability to find words. And agnosia, which is loss of sensory, and aphasia, which is problems with speech. There's 7 stages of Alzheimer's. Stage 4 and 5 is when it starts to get really bad. Okay, so stage 1 is mild. First symptoms is up to 4 years, no apparent manifestation. Stage 2 is moderate. 2 to 3 years disoriented to place and time, speech deficits, wandering episodes, forgetfulness. Stage 3, mild cognitive decline. They're bedridden, dependent in ADLs, loss of mobility and verbal skills, agnosia. Stage 4, mild to moderate cognitive decline, limited memory of recent occasions, depression, and social withdrawal. Stage 5, moderate cognitive decline, inability to recall phone numbers, assistance with ADLs as necessary, they're disoriented to time and place. Stage 6, moderate to severe cognitive decline, can recall own name but unable to recall personal history, personality changes, delusions, hallucinations, requires assistance with ADLs. Stage 7 is severe cognitive decline, it's unrecognized speech, urinary incontinence, inability to eat without assistance, impaired swallowing, and ataxia. The safety considerations is environmental, door locks, sleep training, and keep the lights on. Caregiver support is planned for respite care, educate on disease process and progression of the disease. Orientation, time and place, person, event versus validation, which is therapeutic communication. Routines is admit to hospitals to keep anxiety down. Non-pharmacological is music, and pharmacological is memantine, cholinesterase inhibitors, donepezil. Pimavanserin is used to treat dementia-related psychosis. Delirium, inattentiveness, disorganized thoughts, and an alteration in the client's level of consciousness, resulting in emotional manifestations, including psychotic behavior. Parkinson's. This is loss of dopamine, which is excitable, feel-good hormone. In the beginning of the first stage, it will be unilateral. Meds for pain and tremors is levodopa. Stage 1 is unilateral, shaking or tremors of one limb. Stage 2 is bilateral limb involvement, mask-like face, and shuffling gait. Stage 3 is physical movements are slow, postural, and ability. Stage 4 is akinesia and rigidity, make day-to-day tasks difficult. Stage 5 is unable to walk, stand, and exhibit dementia. Fall prevention intervention, slowly rocking back and forth, lit hallways, no rugs, and heavy silverware. Dealing with clinical manifestations is anticholinergic to decrease tremors. Huntington's disease is genetic, not common, very aggressive and rapid. Men are predisposed with respiratory failure. The pharmacological treatment for Parkinson's is levodopa-carbidopa. The therapeutic procedure is deep brain stimulation, which is an electrode implanted in the thalamus. All right, migraines. It's a viral onset, hormonal or vascular. They have further symptoms. It's unilateral, throbbing, pounding, photophobia, phonophobia, or osmophobia. The triggers are smells, caffeine, stress, aged cheese, wine, pickled things, and artificial sweeteners. The aura is halos or spots. Abortive is ergotamine, you take at night, and the rebound headaches are common, versus preventative therapy, which is propranolol, that's a beta blocker, and calcium channel blockers. The drug alert is sumatriptan. This is an addictive drug due to opioid receptors. Ergotamine is an abortive migraine medication, and it's also used for, look out for chest pain. Surgical therapy is Botox injections and cranial nerve number 5 ablation. Multiple sclerosis is progressive autoimmune disorder that destroys the myelin sheaths, the central nervous system, and is most common in women. The medications is interferon, IgG. This is during the first flare. Steroids is prednisone, and it's an immune modulator. Misoprostol is which is mitoxantrone IV, resolves or slows progression. They're going to have double vision, halos, and inflammation in the eyes. The types is remitting, relapse, which is a high state of inflammation, and demyelination is most common, and progressing. The teaching is tell them to rest, increase protein, and avoid large crowds. The risks is muscle atrophy, falls, bed sores, and cardiac failure. Meningitis is inflammation of the meninges caused by infections. It's viral, which is communicable. The rapid progress is in 48-hour window, and tests for nuchal rigidity, positive Kernig and Brudzinski sign because it's inflamed. Craniotomy is high rate for bacterial meningitis and intracranial pressure. The signs and symptoms are fever, headache, stiff neck, nuchal rigidity, Brudzinski, and Kernig signs. Tier 2 precautions is droplet because it's viral. The lumbar puncture teaching is stay supine for pressure. The complication is increased intracranial pressure, and anything over 15 is too much. The broad spectrum antibiotic is Ancef. And the paid meds, you're going to give them analgesics like Tylenol and ibuprofen. Or in the real life, you're going to give them morphine. Seizures, alterations in cognition causes central nervous system and PNS, and you're going to give an EEG for diagnostics. The types of seizures are absent, akinetic or atonic, myoclonic, and tonic-clonic. So absent is no motor activity and decreased neural status. Akinetic or atonic lasts seconds and there's no movement. Myoclonic is muscle jerking and it lasts 1 to 5 minutes. Tonic-clonic is 1 to 5 minutes, full body muscle stiffening and flexion. The auras are symptoms. This is happening before. This is pre. Ictal is the seizure. Post-ictal phases, the ABCs, confused, lethargic, and tired. Do a head-to-toe neuro-Glasgow-Coma assessment. Seizure precautions and safety. Timing starts when you put your eyes on the patient. Put bed rails padded, safety suction, left side, put them on their left side, position, protect the head. Remember, time is brain. Medication teaching, they're going to give diazepam or Ativan, which is lorazepam. Status epilepticus. This is a seizure that lasts more than 5 minutes. Hypoxia. The interventions is IV, airway, O2, suction, ECG. Medications is Valium or diazepam to stop the seizure. Preventative is Dilantin, phenytoin, valproic acid, Keppra, Tecatrol. This is a long-acting drug. Increased intracranial pressure, TBI. So the intracranial pressure range is 5 to 15. Clinical manifestations is early. The headache, you get a headache, restlessness, increased heart rate and blood pressure, increased respiration. This is agonal. Late is no response, blown pupils, hypertension, bradycardia. They're decerebrate, widening pulse pressure. The assessment is going to be the Glasgow Coma Scale. Their pupils, and that you're going to be measuring their pupils, gag reflex, pain response, withdrawal. Interventions and meds is an osmotic diuretic, which is mannitol, lactated ringers, a craniotomy, and they're at risk for meningitis. You're going to sit them up 90 degrees to allow them to drain and decrease noise, light, give them stool softeners, and sit up for at least 35 to 30 degrees. Brain herniation. This is when the intracranial pressure gets high, the pressure goes down and kills you. Cushing's triad is the end stage. This is a TBI and spinal. bradycardia, irregular respirations, widened pulse pressure, MI, and stroke can happen. Treat with steroids, blood pressure meds, atropine, and decerebrate posture. Decorticate is adduction of arms and flexions of the wrists. Decerebrate is extension. This is for increased intracranial pressure, and that's a brainstem dysfunction. Stroke is blood is caustic to the meninges. This is the brain tissue. TIA's transient ischemic attack. This is a thrombose, which is a blood clot, vasoconstrictions, and plaques. It's resolved less than 24 hours, and it's a warning sign for a stroke. Predisposing factor. Okay, so modifiable is smoking, diet, weight, drugs, cholesterol, and alcohol, versus non-modifiable, which is high blood pressure, diabetes, heart disease, and genetics. Stroke prevention is low cholesterol diet, alcohol, and smoking. Types, so you have ischemic, which is a block, and it happens from blood clots. Embolic clot, which is from AFib or aflutter, versus hemorrhagic, which is from vitamin K, plasma, surgery, aneurysm, intracerebral in the brain tissue, subarachnoid between skull and dura mater. Clinical manifestations and possible interventions. So you're going to see a face droop, slurred speech, one-sided weakness, dysarthria, muscle weakness, agnosia, which is can't recognize items, amnesia, aphonia, which is loss of voice, apraxia, which is verbal and motor skills are misfunctioning and do the fast scale. Symptoms is no left versus right in manifestations. Opposite side, left-sided weakness for the right. Frontal is speech, aphasia, slurring, and angry. Temporal is motor and verbal. And cerebellar is ataxia and lack of proprioception, and brainstem is they stop breathing. Fibrinolytic therapy is alteplase TPA. Only if you know when the stroke happens, you only give that when you know, and if it's under 4 hours. It's not for hemorrhagic. The risk for bleeding, don't give TPAs for hemorrhagic stroke. You're going to give warfarin or heparin, Lovenox, and aspirin. These are blood thinners. And Plavix, alteplase, dabigatran, and TPA. These are platelet non-aggregates. So fibrinogen, amniotic air, fat ischemic. Okay, so fibrinogen, amniotic, and air. These are ischemic stroke types, and you're going to give an MRI. So complications is increased intracranial pressure, aspiration, 30 degrees, suction available all the time. Thrombolytic therapy, abortive, is TPA preventative, dabigatran, and over 160, don't give it. So when the heart rate's over 160, don't give it. They're at risk for aspiration, so evaluation, interventions, sit them upright, suction in room, eat on stronger side, and thicken liquids. Surgery is an embolectomy, and the interventions is elevate the head of bed to 30 degrees to decrease intracranial pressure, preferably 90. That creates drainage. Okay, so traumatic brain injury. This is intercerebral. The complications is increased intracranial pressure, CSF leakage. The interventions is testing for the halo ring. It's the sugar in the spinal fluid. Bleeding, you're going to, this is epidural or subdural. And the brain death is no brain activity, blown pupils, and no motor response. The diagnosis is EEG, and the neurologist diagnoses it. The Glasgow Coma Scale is 3. Organ donation, you're going to protect the organs, contact physician, and lifelink. And who provides the information to client, family about organ donation? The nurse. So the Glasgow Coma Scale, 3 to 15. So eyes is 4. This is fixed dilated pupils. Verbal is 5. No gag reflex motor. 6. Not even to painful stimuli. So brain tumors could cause seizures, paralysis, headaches, nausea, vomiting, and memory loss. Okay, so primary cancer versus secondary environmental. This is oil pits and fumes. So primary is genetic mutations and secondary is metastasized. The treatment is radiation, chemo, and surgery. Spinal cord injury. This is from C1 to C5. This is an incomplete fracture. It's swelling and causing pressure on the spinal cord, may have paralyzed. If it's a complete fracture, more than likely the client will be paralyzed. Risk factors are men 15 to 40 years old because risky behaviors and alcohol. The interventions is repositioning. The level of the injury. So lumbars 3, 4, and 5 is bowel and bladder. C6 and up is diaphragm. This affects your breathing and heart. Thoracic 1 through 12 is paralysis. This is your diaphragm, GI, sexual organs, and extremities. Lumbar 1 through 5 is nerves and lower extremities, bowel, bladder. So the complications is autonomic dysreflexia. This is a side effect of thoracic nerve injury. And then sympathetic versus parasympathetic. So parasympathetic is involuntary. Acute hypertension, low heart rate, wide pulse pressure, anxiety prevention, temp, diaphoresis education. So they're going to do a self-cath, laxative, eliminate stressors, and treatment. To stop the stimulus, you need to raise the head of the bed and sit them up. Myasthenia gravis, it's opposite to head to feet. Acetylcholine issue, they're at risk for aspiration due to throat and neck weakness. Give anticholinergic, IV, reduced immune response, and reduces the production of acetylcholine antibodies. You diagnose it by the Tensilon test, and you give a Tensilon injection. The complications is risk for aspiration and respiratory failure. This affects cranial nerves 9, 10, and 11. A cholinergic crisis is killer bees, bradycardia, bronchorrhea, and bronchospasm. The medications are steroids, osmotic diuretics, albumin, and mannitol. Guillain-Barré is overactive immunity, viral infections, GI, and respiratory. This can happen weeks after infection. Okay, so progression is feet up, ground to the brain. Causes is viral, GI, and respiratory. It's going to be pneumonia. 48 to 72 hours to diagnose before patient becomes paralyzed. Complications and interventions, so paralysis of the diaphragm, you're going to treat with steroids and immunosuppressants. Bell's palsy is a viral infection. It's stroke related to an infection. Clinical manifestations is facial drooping, and the meds to treat are to treat infection, and it resolves on its own. Trigeminal neuralgia is face pain. Often MS patients have this. Preoperative, latex allergies. You need to find out if they have latex allergies, allergic to strawberries, bananas, avocados, or kiwi. Moderate sedation, they're in a relaxed state, they're alert, awake, and they follow commands. General sedation is unconscious. The airway is always intubated. And the allergies, malignant hyperthermia, high temp, muscle rigidity, seizure, tetany, which is muscle spasms, you give dantrolene. Consents for safety and liability. So implied consent is patient unable to speak for themselves, and you're going to give life-saving measures. Informed consent is nurses witnessing the patient signing. For the pre-op checklist, you're going to give labs, which is anesthesia, PT, INR, cardiac, EKG, troponin, all the electrolytes, CBC for infections, and blood type. NPO status because it decreases the risk for aspiration. The teaching is consent, procedure teaching by the provider. Pre-op meds is antibiotics and anti-anxiety. And for safety, you're going to watch out for malignant hyperthermia. You're going to give dantrolene. Intraoperative, the types of anesthesia and considerations. So local is lidocaine and biopsy. Regional is epi, spinal, and deep muscle block. Moderate is Versed and fentanyl. General is gas and IV, so allergies, airways, and watch out for malignant hyperthermia. Give dantrolene if you have malignant hyperthermia. So safety is infection prevention, fire safety, instruments, and count sponges. Post-operative is pain management, bleeding, and infection. Recovery is airway, and give airway O2 cannula. Okay, so preventions of complications is incentive spirometer, early ambulation, and if they're hypovolemic shock, you're going to give blood. Complications and interventions. So dehiscence is splitting and surface layers. That's dangerous. Evisceration is something is coming out and of the deeper layers. It's an emergency and apply a moist, sterile dressing. And compartment syndrome is swelling and pain. A PCA pump is only done by the patient. They only push it. Okay, so epilepsy. Give IV access. Bed rails are padded and suction. So post-op report. You need to know the type of anesthesia, the procedure, vitals, respiratory function, and allergies. Prevent DVTs. You do the SCDs, sequential devices, dorsiflexion, and leg movement. The most crucial thing about a stroke before we give TPA is time of onset, and it's got to be less than 4 hours. Atonic seizure is no movement, and it's a few seconds. Tonic-clonic is muscle spasms. Endocardiogram measures flow, clots, and pressure. Ischemic stroke is know what vital before TPA, and blood pressure should be below 160. Apraxia is the loss of ability to execute or carry out skilled movement and gestures despite having the physical ability and desire to form them. Can't communicate verbally. Agnosia is a rare disorder whereby a patient is unable to recognize and identify objects, persons, or sounds. Signs and symptoms of increased intracranial pressure is reduced stimuli, cluster nursing care, turning the patient, raise head of bed, airway, no coughing or straining, and don't suction. Alzheimer's, psychosocial change in environment causes anxiety and confusion. Aconitic is atonic seizure, no movement, lethargic, and confused. Mitoxantrone resolves or slows relapse in MS. Post-op concerns are high temp, low blood pressure, respirations, and bleeding. This is presented in blood and stool or vomit or GI bleed. Beta blockers help with decreasing vascular changes such as migraines and vascular disease. TIA and ischemic stroke difference. TIA resolves in 24 hours. Proprioceptive is sensory issues and loss of balance. If the potassium is 5.8, you call the doctor. A lumbar puncture, they lay flat and don't do one if they have increased intracranial pressure, and tell them to drink water. Age range for MS is around 20 to 40. And status epilepticus, give a benzo. If you're diagnosed with seizures, keep taking meds for the rest of your life. In the ED, after an accident, there's no waves on EEG. That means brain is dead. The lowest is the Glasgow scale of 3. Maintaining the organs are viable. Dopamine agonist is tremors. Hemorrhagic stroke after a CT, don't strain, suction, and plan for surgery. Venous return for lower extremities is dorsal, plantar flexion, bend the knees, and push balls. Check blood sugar before calling a stroke alert. Safety precautions for seizure patients: oxygen, padded bed rails, suction, and IV access. Associate personnel duties is ambulation and hygiene. Migraines are associated with caffeine, aged cheese, wine, pickled foods, and artificial sweeteners. Hemiplegic patient is thicken liquids, sit up, keep dentures in, and chew on good side. Alzheimer's are incontinent. TPA blood pressure can't be over 160. Guillain-Barré starts at feet, ascending. Suspected ICP, do not do lumbar puncture. Status epilepticus, give a benzo. Beta blockers help with migraines. Informed consent, safety, and quality. Family can't push PCA pump. Mitoxantrone resolves or slows relapse in MS. Alzheimer's psychosocial change and environment causes anxiety and confusion. Apraxia can't communicate verbally. Check CT to see if it's Bell's palsy or stroke. Report immediately for a post-op client any bleeding. Pre-screening for Parkinson's is resting tremors. ICP, elevate head of bed. What are the characteristics of early stage Alzheimer's disease? Complete ADLs, subtle changes in memory and behavior. What are the characteristics of moderate stage Alzheimer's disease? Wandering behavior, agitation, and incontinence. What are the characteristics of late stage Alzheimer's disease? Bedridden, seizures, tremors, and agnosia. Migraine signs and symptoms. Episodic, head pain lasting from 4 to 72 hours, steady ache to violent throbbing, unilateral, worse with activity, aura, photophobia, phonophobia, and osmophobia. Education about propranolol. Take daily at the same time. Multiple sclerosis treatment. Immunomodulators and immunosuppressants commonly given as injections, so rotate injection sites. Clinical manifestations of meningitis. Nuchal rigidity, which is stiff neck, positive Kernig and Brzezinski signs. Treatment for severe migraines. Ergotamine tartrate, taken at the start of the headache and can take up to 6 tablets in 24 hours. Clinical manifestations of meningitis. How does ergotamine tartrate work? It acts by constricting the cerebral blood vessels. Priorities for seizure precautions is lay on left side, adequate airway, and padded rails. How to manage a patient with active seizure. Suction and O2, bed rails up and padded, IV access, give Ativan and lorazepam. New onset of a migraine and the doctor wants a CT with contrast. Ask if allergic to shellfish, seafood, and iodine. Dietary restrictions for people with migraines. Caffeine, alcohol, pickled foods, aged cheese, artificial sweeteners. How can you protect a client with increased intracranial pressure? Increase head of bed to 30 to 45 degrees, and decrease noise in the room, provide stool softeners, prevent elevated intrathoracic pressure. How do Alzheimer's patients act with changes in the environment? Anxious and anxiety. Is our priority with cervical spinal injuries, ABCs and stabilized cervical spine. Stroke nursing interventions. Small bites with food, diet is pureed, watch the affected side for food pocketing and dentures, sit upright 90 degrees, and do not use straws. CSF, clear fluid, halo ring, do not put things in their ears. Stroke, tuck chin to swallow to prevent aspiration. Contraindication for increased intracranial pressure, a lumbar puncture. Elevated intracranial pressure, greater than 20, sustained. Significant sign of ICP, cervical injury, above level C4. Proprioception, perception and position to space. Forget about the body on one side. Monitor blood pressure after giving meds to a stroke patient. Do neurochecks. Treatment for hemorrhagic stroke. Vitamin K, fresh frozen plasma, and surgery. EEG identifies abnormal rhythms in the brain used to identify brain death. Broca's are a receptive speech area. If a person has damage to the frontal lobe, which is the Broca's area, sounds can be made, but words cannot be formed. It is a motor speech problem in which the patient generally understands what is said but cannot speak. MS. What medication is used to help treat spasms? Baclofen. It decreases muscle spasms or cramping. Highest risk with myasthenia gravis. Respiratory compromise. Difference between myasthenia gravis and Guillain-Barré is progression and autoimmune versus viral. Proximal to distal muscle weakness. This is myasthenia gravis. Ascending symmetrical muscle weakness from feet up is Guillain-Barré. Health history of patient with Guillain-Barré. Exposure to virus. Normal intracranial pressure is 10 to 15. Patient care of intracranial pressure of 22. Decrease ICP by decreased noise in patient's room and give a stool softener. What is the easiest lab to do before a stroke alert? Blood sugar check. Echocardiogram, a test of the action of the heart using ultrasound waves to produce a visual display used for the diagnosis or monitoring of heart disease, AFib, and clots. Caring for patient with stroke that has Broca's aphasia. Communication board. TIA, indications you're going to have a stroke, a high risk of a stroke. Family decides that they want the patient to be an organ donor. Ensure organs maintain perfusion. Looking at CSF that has yellow ring tests. This is positive for glucose. Patient in ER that has stroke but CAT shows hemorrhagic stroke. Prep patient for surgery. Patient with Parkinson's and displaying slow movement, this is dyskinesia. Patient states he knows he needs extra time to complete activities. He understands his condition. Patient with BLE, loss of sensation, this is Guillain-Barré syndrome. Improving breathing post-surgery, this is encourage patient to use incentive spirometer, deep breath, and cough. Priority assessment after spinal surgery is ABCs. Patient with seizure would be described as a loss of consciousness, incontinence, and breathing cessation followed by postictal state that lasts 10 minutes. This is tonic-clonic. Patient going to surgery, labs came back, HGB of 3. Notify provider and no surgery. Baclofen, this is a muscle relaxant. Levodopa, this is used for Parkinsonian symptoms of shaking, stiffness, and difficulty moving. Which vital sign after TPA is most important to control 24 hours? Blood pressure. Sudden chest pain, dyspnea, cyanosis, and tachycardia. PE. Which phase do you count sponges? Intraoperative. Preventing DVT post-operative. Early ambulation, SCDs, and anticoagulation. Evisceration care. Apply warm, moist, sterile saline dressing. Mask-like face, muscle rigidity, and hypokinesis. This is Parkinson's. PCA pump. Client controls it. Patient with paraplegic T6 to T7 priority autonomic dysreflexa. Assess for bowel and bladder distension. Patient with major seizure and is now sleeping for long periods. Postictal phase. 3 components of Glasgow Coma Scale: eye opening, verbal, and motor. Scrubbing hands for surgery, 3 to 5 minutes. Field and find patient with head injury, clear drainage from nose. Don't blow the nose. Head injury and ED. Do not do lumbar puncture. Components of Cushing's triage: widened pressure, bradycardia, and hypertension. Parkinson's screening: shuffling gait, proposal, forward movement. Agnosia: cannot recognize or identify objects or people. Myasthenia gravis, IgG, is used to decrease production of acetylcholine. Delirium: acute confusion. Anomia: inability to find words. Patient unable to wrinkle forehead. Bell's palsy. Gave patient Ativan 20 minutes ago to promote safety. Raise head of bed and put rails up. Informed consent, patient doesn't understand. Get the provider. Surgery, tachycardia, diaphoresis, rising body temp, emergent situation in operating room. Malignant hyperthermia. Treatment for malignant hyperthermia. Dantrolene. Which nurse is responsible for verifying consent form assigned? Circulating nurse. Patient with general anesthetic. Know what general anesthetic, so gas to breathe in and med and IV. Patient understands operative teaching. I will sign consent form. Surgeon will want me to ambulate. Nurse will want deep breaths following surgery, constipation with pain meds. General anesthesia. This is gas and IV medication. Morning hygiene, ambulation, and routine vitals. This can be delegated to a UAP. Seizure interventions. Teach patient to continue phenytoin or other antiepileptics even when seizures have stopped. Spinal cord injury interventions. Risk for ulcers, VTEs, reposition client every 2 hours, ensure client is wearing dentures during feedings, and thicken all fluids. Atonic seizure. Sudden loss of muscle tone lasting for seconds, followed by postdictal confusion. Simple partial seizure. Focal seizure in which consciousness is not impaired. Pseudo seizures. Clinical events that are not associated with abnormal cortical electrical discharges. Embolic stroke. Often result from heart disease or heart surgery. Apraxia. Apraxia is an effect of neurological disease. It makes people unable to carry out everyday movements and gestures. For example, a person with apraxia may be unable to tie their shoelaces or button up a shirt. People with apraxia of speech find it challenging to talk and express themselves through speech. The patient with an ischemic stroke cannot receive thrombolytics until which vital sign is within normal limits. Blood pressure. Early signs of increased intracranial pressure. Change of level of consciousness, speech is slow and slurred, delayed verbal response, increasing drowsiness, restlessness for no reason, and confusion. Symptoms of cholinergic crisis. Muscular weakness, increased saliva, and increased hearing. Abnormal postoperative signs. Emesis, that is red. Ptosis. This is myasthenia gravis. Ascending paralysis. This is Guillain-Barré. Malignant hyperthermia. Medical emergency, temp of 104 or higher, muscle rigidity, dantrolene for treatment. Potassium of 5.8. Notify the physician. Right hemisphere stroke. Patients with right hemisphere brain damage typically have difficulty with visual, perceptual, or spatial perceptual tasks. They often have problems with depth and distance perception and with discrimination of right from left or up from down. Quadriplegia or tetraplegia. Paralysis in all 4 limbs. Paraplegia. Paraplegia and paraparesis. Paraplegia is paralysis and paraparesis is weakness. Involve only the lower extremities as seen in lower thoracic and lumbosacral injuries or lesions. Thoracic spine injury. Paralysis in legs but arms can still function. Loss of bowel and bladder control, which could result in retention and pain. Bacterial meningitis. Inflammation of the protective membranes covering the brain and spinal cord caused by various types of bacteria. Signs and symptoms is photophobia, decreased level of consciousness, headache, fever, nuchal rigidity, positive Kernig and Brzezinski sign. Use droplet precautions and can be contacted in crowded areas. Bell's palsy, temporary paralysis of the 7th cranial nerve that causes paralysis only on the affected side of the face. Baclofen, muscle relaxer used to treat symptoms caused by multiple sclerosis. Seizure precautions include ensure rescue equipment at bedside, inspect client's environment for items that may cause injury, assist client at risk for seizure for ambulation, advise all caregivers and families not to put anything in their mouth, advise caregivers and families not to restrain in an event of a seizure, administer meds as ordered, note duration of seizure, after seizure explain what happened, and document the seizure along with precipitating factors. Bradykinesia. Slow movement is commonly seen with the rigidity of Parkinson's disease. The treatment is a dopamine agonist. Broca's aphasia. An aphasia associated with damage to the Broca's area of the brain, demonstrated by the impairment in producing understandable speech. The intervention is provide a communication board. General anesthesia. Anesthesia provided by gas or IV. The patient is not arousable even with painful stimulation. Airway intervention is required and positive pressure ventilation may be required. CV function may be impaired and is associated with malignant hyperthermia. Regional anesthesia. This is an epidural. Injection into the epidural space, which is anorectal, vaginal, perineal, hip, lower extremity surgeries. Moderate sedation is previously referred to as a conscious sedation, involves the use of sedation to depress the level of consciousness without altering the patient's ability to maintain a patent airway and to respond to physical stimuli and verbal commands. Local sedation in very local area like skin lesions may have anesthetic and epinephrine together. Glasgow Coma Scale. 15 is full consciousness. 8 is a possible critical condition related to coma or inability to maintain one's own airway. 3 is the lowest possible score. It's often related to impending death. Stroke alert. Patient presents with suspected acute stroke by assessment of signs and symptoms and without known contraindication for TPA. 3 to 4 hours from last seen, well onset of signs and symptoms before any diagnostics are completed. Assess the client's blood glucose. Increased intracranial pressure. Maintain neutral head and high Fowler's positioning. Seizure precautions. Suction equipment at bedside, Valium or Ativan. Dysphagia interventions. Aspiration precautions, no straws, Fowler's to high Fowler's, tuck chin with swallowing and observe for pocketing of food, keep in at least semi-Fowler's 1 hour after eating, and provide oral hygiene. Bell's palsy signs, inability to move facial muscles. Levodopa, carbidopa treats, muscle rigidity and tremors. Phenytoin, Dilantin, anticonvulsant, seizures. Trigeminal neuralgia, inflammation of the fifth cranial nerve characterized by sudden, intense, brief attacks of sharp pain on one side of the face. Epilepsy, a central nervous system disorder characterized by loss of consciousness and convulsions, recurrent seizures. Cerebral aneurysm, the widening of abnormal dilation of a blood vessel in the brain. Myasthenia gravis, chronic autoimmune disease mediated by acetylcholine receptor antibodies that act as a neuromuscular junction. Ptosis is the inability to open upper eyelids, head and neck muscle weakness. Cervical injury above level C4. This is total loss of respiratory muscle function and mechanical vent is required to keep patient alive. Late signs of ICP. Alterations in VS, including increased systolic pressure, widening pulse pressures, bradycardia, blown pupils, and decerebrate posturing. IV immunoglobulin, gamma globulin. This is decreased production of acetylcholine antibodies. Pulmonary embolism or PE symptoms. This is sudden onset of chest pain and dyspnea, shortness of breath, accessory muscles being used, tachypnea, pleuritic chest pain, tachycardia, cough, hemoptysis, and unilateral low extremity edema due to DVT. Atelectasis. This is the collapse of a part of a lung, the acute form of common after chest or abdominal surgery. Chronic form is often for some sort of blockage or spore spreading of surfactant during inspiration. Signs include chest pain, difficulty breathing, fever, and cough. Surgical consent. The surgeon is responsible for obtaining an informed surgical consent. If patient does not understand the procedure or has further questions for the surgeon, refer the matter back to the surgeon. Lumbar puncture contraindications. Patients with increased cranial pressure because rapid loss of CSF can cause brain herniation. Preoperative teaching. Instructions regarding a patient's anticipated surgery and recovery given before the surgery. Instructions include but is not limited to dietary and activity restrictions, anticipated assessment activities, postoperative procedures, and pain relief measures. Decreased venous stasis. This is early movement and ambulation. Surgery complications. DVTs, bleeding, damage to laryngeal nerve, and infection. Head injury or skull fracture. No nasotracheal suctioning because it increases ICP. No sneezing, coughing, or blowing the nose, and do not place anything in the ears. Methods to prevent alveoli collapse. Deep breath and cough. Carotid angioplasty. Balloon-tipped catheter threaded to the site of the blockage, and the balloon opens and flattens plaque, or a stent is placed. Watch for signs and symptoms of stroke, muscle weakness, acute confusion, severe headache, and dysphagia. Ergotamine tartrate. Migraine prevention. Surgical site marking. Surgeon before patient receives any sedation by physician and confirmed by the nurse.